Hi, I'm Daniel, and for the purposes of this video, this is more of an example of rehabilitative hip exercises. I thought now would be a good time with this video to kind of go into where I am in my cancer treatments. The last meeting I had with my oncologist, we decided to switch to once a month treatment, and no, once every 6 month treatment instead of once every month. Before I was getting a shot of Lupron once a month, and I decided that if I was going to have to be on treatment indefinitely, I might as well just do it every 6 months. Um, One of the other things I was hoping to that would happen so far, it's worked. The other medicine, the other treatment once a month, I would at some point during the month have a 36 to 72 hour bout of extreme nausea. I don't know if that was from that or from other meds that they're giving me. Um, but I don't think it was from anything else. I think it was from that. It has not happened again since I have started on the 6 month regimen. Um, at some point, I'm supposed to take a break because your body can only handle so much bone loss and stuff. Anyway, uh, my the guy, what do they call those? The surgeon. Anyway, the guy who did the prostatectomy. He I had a meeting with him. He used the word remission, and I was like, well, okay. I was under the assumption that remission meant undetectable, no treatment, no nothing. As long as I am in treatment and there are no signs of cancer, that's considered remission. So I learned, I was educated a little bit upon what remission is. Remission does not mean cured or you don't have to get treatment. Remission means it's undetectable, which is a good thing. But as many people know, and as you probably know somebody who heard the word remission and it came back. Um, don't think of remission as a cure. Just it's a stepping stage in between. It's a good thing, but it's not. You're not cured. Just means the cancer is not detectable. So for now, I'm doing pretty good. I'm tolerating the treatment. The fatigue is still, and what I mean by fatigue is it's mostly kind of more of a brain fog in the evening. It starts with a little bit of a brain fog and then physical fatigue. And I can tell the fatigue is, I don't want it medically induced or hormonally induced or whatever, because I can keep doing things. Um, but I don't know if I would say safely that the cognitive issue is the really big aspect after 4 or 5 o'clock. Um, I, I struggle a bit more. Sundowners, I guess. Anyway, this during my during my um, radiation, I'm going to go ahead and bring this up. I had a 8 weeks of radiation, and it was difficult. It was pretty difficult. Let's put this in another. Okay, so the the radiation went. I don't know if you can see my right across where the widest part of the hip is where the beam went around twice. It's like a flashlight going around you. It doesn't hurt or anything until later. You're just like, ugh. But the easiest way to describe it is it feels like there is mostly scar tissue and dehydrated muscle there now. So pretty much anything around my hip is still really, really uncomfortable, really tight. So this can kind of give you an idea. What I want to show here are the muscles that that the radiation passed through to get to where the prostate area was. It feels like pretty much all of these muscles, down the quadriceps, even low back, anything that attached, inserted, or originated or inserted from this area, um, was affected. It gets fatigued faster. It is very slow to strengthen or very slow to respond to flexibility exercises. Before I did the treatments, before I went through cancer, I was fairly flexible. After radiation, I have struggled to maintain. I'm probably at normal human flexibility, which is just tight to me. I'm just uncomfortable. I'm trying to slowly um, achieve, revive my flexibility. Easiest way to say it. It's difficult and it's time. It feels like um, every day I wake up and I start it all over. My hips feel like Groundhog Day. It's like I exercise. Oh, maybe I'm making some progress in the morning. The progress is slow. I can tell there's progress compared to months ago, compared to last year, compared to last week, compared to last month. No, it feels like there's no progress. So I have to focus on the long-term progress, not the last few weeks. I'm trying to just maintain strength. I'm trying to keep them from getting worse. I don't know if I can get them any stronger. I hope I can. But I don't want to let them get worse. I'm going to go ahead and let it start now and keep talking while I do this and started the watch. The first one is the hip. Oh, I'm doing. Oh, let me explain what I'm doing here. I forgot to explain this. Um, this is something I do as part of recovering um, from the radiation. My Before I start working out, my hips feel like concrete, like dry concrete. Um, the one single squat, and I call this, I don't call this. This is called laddering. Add one each time. That's why it's plus one. The goal is not volume. The goal is to get my hips to be up to be full range, full squat. One of my other goals, I used to be able to do 50 squats in a row. I don't know. I mean, body weight squats in a row, 2 up, 4 down. Um, I don't know if I'll ever be able to do that again, but I kind of want to. That's as far as like an endurance measurement, a practical endurance measurement. Most of the things you're going to be doing are going to be with your body. So 50 squats, body weight squats in a row, good form, are good measure of where you are endurance wise. This is internal rotation. Let's see if I can find where did it go. These are so bad about internal rotation. Okay, so there's some. Oh, here the bone of your femur is internally rotating. Is easier way to think it. Your foot is going out, but your bone is rotating in. Uh, Josh Trentine, thanks again for redoing that on me. I don't think this is okay. Adductor one. Anyway, this is the muscles I am exercising. I am pushing my foot out against the blue block, and my uh, gray blocks are arresting the force. I'm not pushing in, they're just holding it there. So these muscles, go back up. Here it is. The muscles that are going to be worked in these different exercises are those. This was for this one. Did I stop it? No, it's just slow. There we go. So now, after I do each exercise, I started in a wide stance. If you notice that first one, wide stance, almost like a horse stance, going down into martial arts horse stance. Now, this is a little more narrow, and I'm trying to get my hips to go down a little further. And I'm going to try to hold it there and then come back out of it gently. I'm trying to do a 10-10 count. That's too fast going down. Okay. Little too. So that needs to be improved. The speed on those. I got very thirsty. The effort on the static, I'm not doing 30, 30, 30. This is 50% for 90 seconds. So this will be, let's see, hip external rotator muscles.
Get ready for 15 seconds.
So I'm not exactly sure. Anyway, these are the muscles I'm trying. Let's see if I can make this a little bigger. No. These are the muscles I'm trying to get. Again, all of these muscles were affected by the radiation. So it is very necessary that I do these. If you are going through radiation therapy for prostate cancer, if you can, try to do these exercises through it, even this sequence with the squats too. You're not trying to increase your strength, you're trying to maintain it. The dosage of radiation I got was so much that I was fatigued the whole time. I could barely get out of bed. I had enough energy to eat, barely make it to the um, uh, therapy place, and then back home 5 days a week. And then went to bed. That was my 8 weeks of that. So yeah, these muscles were affected. If your dosage is less, or you not getting fatigued during radiation that much, you're getting a little bit, try to do these. Um, you can do these also on a desk. Okay. Where'd we go? There it is. That was the one that just worked. And now we try to do a few more reps. Squat reps. Okay. Now I'm going to try to do. Um, I let myself slowly go down into what people sometimes call an Asian squat. It's a human squat. This is where I kind of let my body find where my feet go. And I want to get back to where this is comfortable again. I can do it. I can be there. It's not as comfortable. I used to be able to just relax there. I look like I'm okay, but it's not as comfortable as it used to be. So my goal here is to get back where I can. Now, I am not relaxing in this position. I am staying very tense. I'm not letting the tension off, even when my calves are touching the back of my hamstrings. Um, I'm not letting it collapse and fully relax. I'm staying full tension on right there even. That was too quick of a, I was not a little too quick, I was too quick of a turnaround. The lower turnaround, probably the most important turnaround of all the parts of the repetition. More water. I was already very tired from just this. After this, hip abduction, not hype, hip abduction, muscles worked. Let's see. Here we go. Don't do it like this, please. Do it like what I'm showing you. This is abduction. I'm sitting up straight. Where are the
Get ready
muscles
for 15
used?
seconds.
I'm sitting up straight in it.
That's halfway.
Yeah, here we go.
3, 2, 1. Slowly increase to 50% effort for 1 minute and 30 seconds.
This is better. So I wanted to try. I can go from all the way straight. I can go all the way leaning forward. All the way straight seems to be as far forward as good enough. I've tried it all the way laying down. That's too much active insufficiency. I think maybe right about this position is kind of a neutral position for the torso. Still not sure on that. And I'm not really convinced by anybody's argument about it either. So, oh, spin the wheel. Yay, okay, whatever.
That's halfway.
Come on, there we go. So these are the muscles I'm trying to work here. And you can see just like all the others, where that radiation beam went, right in there. I'm thirsty. Looks like I'm just relaxing. I'm not. The toes out. That seems to make me feel like I'm pushing a little harder. You don't. That's not necessary. If it helps you, it's okay. But it's not really making a difference
Slowly
to the
release effort, then relax.
uh, physics of the exercise. A lot of things people do, a lot of little things people do are mostly mental adjustments, not physical. I have my fan on. I got a hot flash going. This I'm going to go a little faster. This is, I think, a five. Is this 2 up, 4 down? No. This is. I'm trying to do 5 up, 5 down. And I think my dog was scratching at the door. I was trying to ignore her here. Daddy, are you okay? So I try to add just one more repetition. And I'm not trying to do volume training at all here. I'm trying to get my hips to a state where I can give a little bit more of an effort. Also, by fatiguing my hips this way, when I'm doing squats, I don't mean pre-exhaust, but it makes the squat more comfortable. So this is just hip raise. And my back recently, lower back has been irritated. Mostly that happens if I sleep on the one side wrong in the night. I'm not sure. It's not getting worse or anything. I just need to sleep on the other side more. I usually wear socks for this.
Get ready for 15
I mean
seconds.
shoes. Um, if I'm doing a hip raise, I don't think, yeah, if I figured out I don't need to
That's
do
halfway.
shoes. If I'm doing where it's
3,
up and I'm
2,
have the
1.
belt
Slowly
and I'm
increase to
doing
50%
a
effort for 1 minute
trunk
and 30 seconds.
extension, then I do need the shoes. But for this one, I don't. And my back does feel a little bit better after having done this sequence today. And my plan is, if I feel good, lower back wise, to do the trunk extension. If it's okay, or if I've already done the trunk extension the previous week, lumbar extension, and then hip raise. So I'm going to alternate these in this sequence. And I've kind of been doing that.
That's halfway.
So this was the last exercise before my quote squat test. And in my squat test, at the end of each one, I'm just going to try to see how many I can get. One of the reasons I wanted to show this sequence today is in my big six workouts, um, I was aware that the belt squat was significantly uncomfortable enough that I was not able to give as much of a full effort. At best, it was kind of telling me where I should be in a static squat. Okay, these are called, I think, I can't remember if these are McKenzie or Williams, because there's McKenzie Williams flexion exercises. Pull it, and then you do your nose to your knee. And this is a stretch for your low back and hip. It is not an abdominal exercise. This is hip stretch and lower back. And I do those after that one. Got to figure out a better way to get up. Now is the squat test. Now I'm trying to stall because I don't want to do it. It's like, okay, let's get this over with, damn it. I have no head. One, let's see, four, three, two, too fast. Three, two, that's okay. Four, three, two, one, two, one. I'm trying to do about a two up, four down. I really don't want to go any faster than this. And I'm trying to be very careful in that bottom turnaround. I need to do better. Even if I'm going quicker, that bottom turnaround is, I'm just trying to get through them. And that's too much. Even if you try to do explosive training, do that lower turnaround smoothly and then go as fast as you can if you're going to do that. I don't recommend explosive training at all. But like if it's bench press, do the turnaround gently, and then right after you start going, then try to go faster. But don't. Just the turnaround should be smooth. And this was it. Yeah. Okay. So for the hips, if you're going through um, physical therapy for your hips, for hip injury, um, I will try to remember to link a video to Drew Baye and Ken Hutchins' video on how to do physical therapy for a hip injury. This is not physical therapy for a hip injury. This is, well, they are kind of sort of injured. This is for recovering from radiation. So it's not the same. I'm able to do different things. This may be something that would be a higher up level in a rehabilitative sequence, but not something for a hip injury. I will put that one in there. Anyway, this is not a workout. This is more, like I said, this is more rehabilitative exercise. I hope it was educational and helpful. And if anybody has any questions, if you are having any issues with hip pain and prostate cancer, stuff like that, um, let me know if something like this has helped you or if this sequence does help you. Thanks. Bye.